Hello, everyone, and welcome to Lecture 4 in our lecture series, Mental Health and Aging in Rural Areas. This is the fourth and final lecture in this series focusing on older adults living in rural areas and their experiences with mental health and mental health care. My name is Morgan Stengel. I am a current social work PhD student here at the University of Iowa, and I'm working with Dr. Nadia Saba-Steinberg on this project about older adults in rural areas and their mental health. In this last lecture, we will be discussing, once again, the 4Ms, and with a particular focus on mobility. The 4Ms is part of an age-friendly health system developed by the Institute for Healthcare Improvements. Mobility is the last M in this lecture series, and we have already discussed what matters to older adults, their values. We also discussed medication in a previous lecture, and we also discussed mentation, or the overall mental health of older adults living in rural areas. For mobility, we'll be looking into how do older adults move, how do they access services while living in rural areas. We'll also be talking about social networks today. Social networks we briefly talked about in Lecture 3 as well, but in this particular lecture series, we'll be focusing on social networks and how older adults access services through the lens of mobility. We'll also be discussing physical barriers to mental health care services for older adults, and these physical barriers will include transportation, geographic distance, and income. And then we'll be discussing the recommendations based on mobility and social networks and physical barriers and how we can overcome these barriers to help older adults living in rural areas access more services. And this will include telemedicine and telehealth. Before we get into barriers, we can talk about mobility for older adults. And mobility in the 4Ms specifically looks into the physical mobility of older adults and how older adults move safely in their homes and in their communities. This can include walking, running, exercising, swimming, things of that nature. In this lecture series, we'll be looking into the longer distances of mobility for older adults. And this can be how older adults move safely in their community and surrounding areas, and how they can safely access services and resources in rural areas. And this can include driving, using public transportation, and car services. So overall, we'll be looking more at these longer distances of mobility and how older adults experience mobility and the barriers of mobility for older adults who live in rural areas. So mobility itself can be a barrier because there can be several different aspects to consider when a person ages and if this person, as they age, are living in a rural area. So we can consider driver licensure, broken vehicles. These are transportation-related mobility barriers. We also could include chronic illnesses, which may make an older adult housebound. This can include cancer, chronic pain, things like that. There's also the reliance on family or friends to get to appointments or to access services. This is another way mobility can manifest as a barrier. Overall, transportation was a major barrier for rural and chronically ill patients. Several older adults reported a lack of mobility or independence for traveling, such as not having, the driver's license. They can be housebound, like we talked about. So in order to think about mobility as a barrier to obtain mental health care services, this is very important to think about for older adults as we move into more about mobility as a general topic. There's many difficulties in the physical area of older adults that they experience when considering mobility. So this figure is from the U.S. Census Bureau in 2017, and we can see here that independent living difficulty, ambulatory difficulty, and just general any disability were some of the highest difficulties related to mobility for older adults. In 2017, about 46% of people aged 75 and older reported having difficulties in physical functioning. The percentage is more than twice as large for the age group 45 to 64, about 19%. The percentage of people aged 75 and over reporting difficulties in physical functioning ranged from 5% reporting it as very difficult to, or even cannot sit for 2 hours, to 30% reporting it very difficult to, or even cannot to stand for 2 hours. So when we're thinking about the physical ability of older adults living in rural areas, how can we help with these physical difficulties for older adults to access mental health care. And one particular way we can look at mobility is through social networks. And this can include family members, friends, just general social networks, things of that nature. It's very important to think about how older adults can utilize their social networks to decrease mobility as a barrier. Family and friends can help drive them places, and this can overcome that physical distance to mental health care services. So there are challenges in general in attracting and maintaining specialist mental health workforce and in delivering services across sometimes sparsely populated and large geographical areas. So who are taking older adults to mental health care? Who is supporting them? These social networks is one way to do so. So now we can continue to think about social networks and mobility. Aging in place often allows seniors to retain their existing social networks. It can help them dictate when and how they want help, and older adults can experience greater comfort in a place where they have created a home. Overall, nearly 90% of older adults want to stay in their own homes as they age, which of course includes older adults living in rural areas. A 4-year analysis of aging in place by the University of Missouri-Columbia found that those who received care in the homes experienced improved mental and physical health compared to individuals who resided in nursing homes. Transportation, which is an aspect of mobility, is vital for aging in place since it increases opportunities for many older adults to reach medical appointments, shop for groceries, attend social activities, etc. So these social networks are a primary source for older adults to access services. And in this lecture series, of course, we're talking about mental health care services. So having an older adult who feels they have a trustworthy social network, they feel safe with their social network, they may be more likely to talk to their social network if they're having problems maybe with mental health, mental illness symptoms, things like that. This older adult may be able to use their social network as a way to access mental health care. Briefly, I mentioned how it is hard to attract specialized workforce of mental health care providers in rural areas in general, but also mental health care providers who have training or connection to older adults, gerontology, aging studies. So that's another issue that is encountered. So we have economic barriers as one way it can deter older adults from seeking mental health services, the actual geographic location, that distance between them and the services. Do they have a social network as well to help get them there if they want to access it? Of course, we talked about a smaller number of mental health providers in rural areas, and we also have primary care providers, or PCPs, as one way to overcome these barriers, decrease that geographic location, decrease economic barriers. But of course, there are some issues with training for PCPs and the PCP's mental health care screening abilities as well. But first, we'll move into geographic location and income as barriers for older adults. So in this slide here, this is from the U.S. Census Bureau, and from the two darker blue colors, you can see these are percent of persons age 65 and over in 2017 by state. And you can see Iowa is a quite dark blue, so it's about 16 to 17.8%. That can include Missouri, some of these southern states down here as well, Pennsylvania. And then this striped blue here is one of the highest, so you'll have Texas, California, Montana. So if we're thinking about perhaps more rural states, such as Iowa, there is a large percentage of people age 65 and over in the total population. And this graphic, also from the U.S. Census Bureau, 2012 to 2016, this is by counties. And this middle figure here is mostly rural counties, which is about 50 to 99% rural. And you can see here, including Iowa, it's in the 20 to 24% and even to the 25% or greater. So there is a large number of older adults living in these rural areas. There's also many more older men relative to women in rural areas compared with urban areas. And one of the reasons is that mostly men seek rural farming and mining jobs when they're in their 20s and 30s, and they stay, and they are aging in place in these rural areas. Also, other factors can include different life expectancy for men and women by urban and rural status, and domestic migration patterns, particularly for retired married couples, which these retired married couples may be moving into the Sun Belt, the southern states, for example. And in a previous lecture, when we discussed depression and suicide for older adults, men age 65 and older are in the highest risk for suicide. So that's something else to think about for men in rural areas and their experiences with depression and suicide. So this slide here now is looking into income a bit more and says more than 7 million people ages 65 and older had incomes below poverty level in 2017 based on the supplemental poverty measure, and 2.5 million more than under the official poverty measure. So if we're looking at older adults, they are experiencing lower levels of socioeconomic status. And if we're thinking also rural areas tied into that, these older adults living in rural areas may experience even more of a disadvantage in the socioeconomic status. And payments from Social Security and supplemental security income, it has played a role in enhancing economic security and reducing poverty rates among people age 65 and older. Yet many older adults still have limited income and modest savings. In 2016, half of all people on Medicare had income less than $26,200 per person. This analysis provides current data on poverty rates among the 51.1 million older adults in the U.S. So this is a very important aspect to think of for older adults who want to access mental health care services. If they feel they're not financially able to supply that for themselves or be able to find it, that will be a factor in how they decide whether to seek services or not. And so now we can think about mobility less in the physical terms, less in the economic terms, and think more about mobility in the social terms. When we're thinking about rural areas, there is a lot more distance in the communities, physically and perhaps even emotionally at times, from family and friends. So if we can tie that physical distance to social distance, we can see that these issues are connected through the lens of mobility. And how can we utilize the community, its support, to overcome this barrier in mobility? And so this graphic here has an older person at the center. They have their family and friends, which is their social networks. And this family and friends can help them access this larger community environment, such as housing, social environment, social activities, the opportunity to participate in the community, access transportation to services, and also receive information from their community, their family and friends, and help them feel more connected. And then we can connect this broadly to the policy environment and how can we influence the community environment to improve older adult access to mental health care. So when we're thinking this distance in both physical and social terms, we can improve mobility for older adults when they are trying to access mental health care. So now that we've talked about mobility overall for older adults and barriers that can influence their ability to be mobile and to access mental health care services, we have the following recommendations. First, we can decrease distance in accessing mental health care by training and utilizing primary care providers, or PCPs. PCPs are very important to older adults for their physical health, but also even for their mental health. Older adults may feel more comfortable talking to their PCP about mental health care concerns or how to access mental health care because they have that established trust and relationship. We can also attract more mental health providers in rural areas through funds and grants and thinking about companies that could expand into rural areas to provide professionals with benefits and insurance for these professionals so they feel secure to be able to move out to these rural areas and provide services and still be able to have an income for their families. And one of the concerns with using PCPs, of course, is sometimes PCPs are not necessarily trained for mental health care. They may not be screening for mental health issues for older adults. There can be the common stereotypes that perhaps older adults may not even experience mental health issues or concerns because they're older. There's that stereotype there. So we can think about training PCPs, providing more information for PCPs so they can specialize then in mental health care for older adults in particular and provide some resources for them. So this is one way to decrease distance. Another way we can decrease distance is looking into transportation directly, which is one of the most impactful interventions we can consider and implement for older adults. Like we're talking about before, older adults may not be able to drive anymore. They can drive, but can't drive those long distances from where they're living in a rural area. So we can look into cars or buses to help older adults get to and from appointments. That's one way we can look at it. We can also look into technology as one way to overcome mobility as a barrier and look into telehealth and teletherapy. Some of the drawbacks for this may be older adults may need assistance to set up and access these kinds of services, including like Wi-Fi concerns, things like that. There may be a learning curve perhaps there. And then also there's that financial side of things that we talked about, with older adults may need assistance to obtain technology that can be used for these appointments. Can they have a computer that has a reliable connection, network, things of that nature? And more so into telehealth and teletherapy. This graphic here gets into the pros and cons of using telemedicine or telehealth. For telehealth, of course, there's limited risk and exposure to infection. There's no need for transportation, so that can remove that barrier entirely. It's convenient. However, there are those technological limitations. Of course, healthcare data breaches, lack of physical interaction. These can be drawbacks for older adults when considering it. And when we talk about in-person doctors or perhaps the older adults' PCPs, we can look at, the rapport between patient and doctor and that established trust and relationship that older adults value. But as we talked about before, having those in-person therapists, mental health professionals, in-person doctors, mobility, getting to that location is a concern. And then longer waiting times, increased risk of infection. So these are just one way to consider reducing physical distance and improving mobility for older adults. And now that we have been able to discuss mobility, which is the final piece in the 4 M's, we can look into just a final discussion of this overall series and the 4 M's. And the 4 M's in general are used to increase awareness on mental health issues for older adults. And this can apply for family members, the actual older adult as they age, for this older adult's primary care provider, and for their mental health professionals in rural areas. So continuing research in mental health for older adults, especially in rural areas, is vital to this series and to the overall research and policies at large. In order to increase health literacy for older adults, using this framework of what matters to older adults, what do they individually value in their lives, and work towards those and tie it back to mental health care, that may help improve mental health literacy for older adults. And if we can transition to a more integrated healthcare system for older adults, especially the older adults living in rural areas, with an emphasis on the dignity of older adults and their decisions that they make in their care, can also help when they're thinking about medication, mobility, the types of services they want to access. We can also think about primary care provider education on implementing behavioral health interventions through training, licensing, technology, adding more insurance coverage that can help assist with this medication and mentation piece and improve the overall mental health of older adults. And of course, if we attract rural providers and improve primary care provider training, in particular for older adults and their mental health, can also improve mobility. And finally, including social networks and support in mental health care treatments and plans for older adults will be extremely helpful for older adults in rural areas because their social networks are so highly valued. Overall, the 4 M's goal is to help identify what older adults want, what matters to them, and how can providers in their areas, researchers, policymakers, and their family members, how can we all come together to help these older adults achieve their mental health care goals and guide their healthcare decisions their healthcare wishes to what they value. So thank you, everyone, for attending this lecture series and learning more about mobility for older adults in this lecture series. You can always go back and listen to the other ones, which includes what matters, in depth, medication, and mentation for older adults. And we can really focus on this lens of promoting the dignity of older adults and what their values are. So once again, thank you. And we appreciate everyone's interest in this lecture series.